more CSR money flowing through social stock exchange in healthcare, in education, in skilling and other sectors, which will kind of allow more and more philanthropic capital getting invested in this space. So these are 2-3 ways in which philanthropic capital can play a key role as a catalytic support, as a de-risker, as well as through mechanisms like the social stock exchange.
Hello and a warm welcome to a very special podcast series, Unusual Suspects. I'm your host, Gaurav Chaudhary. This is a series about unraveling stories of entrepreneurs, investors, and businesses that are disruptors yet not in your face. Their disruptions have consistently delivered on the purpose and the mission they've embarked on. Their values are as strong as the mission. While they're ruthless in pursuing their ambition, they don't stray from being leaders who are not just admired for the vision and relentless pursuit, but also for how they're building an ecosystem of believers who consistently push the boundaries. They allow principles to take precedence over ad hocism. For them, profitability is as important as scale, creating and leading new categories and innovations. In each episode, I speak to one such leader, talking to her or him or them about their businesses' lives, inspirations, interests, challenges, pivot moments and turning points, successes, failures, agonies and excess, and of course, the little joys of life. It is as much about their personal life stories as about their entrepreneurial and professional journeys. Unusual Suspects streams on Earshot.in, Spotify.com, Apple Podcasts, Google Podcasts, MoneyControl.com, and a host of other podcast streaming platforms. For this episode, I'm delighted to have Himanshu Sikka, Project Director, SAMRIDH, and Chief Strategy and Diversification Officer, IPE Global. Sustainable access to market and resources for innovative delivery of healthcare, or SAMRIDH, a blended finance facility supported by USAID and implemented by IPE Global, was initiated amidst the pandemic. The initiative is driven by a network of partners, including Atal Innovation Mission and Women Entrepreneurship Platform, Niti Aayog, Principal Scientific Advisor to the Government of India, the National Health Authority, the Indian Institute of Technology Delhi, Axis Bank, IndusInd Bank, Rockefeller Foundation, Caspian Debt, and HDFC. Welcome to Unusual Suspects, Himanshu. Delighted to have you on the show.
Hi Gaurav, thanks for having me here today. Pleasure to connect and happy to be part of this podcast.
Thanks so much, Himanshu. Let's start off with a question that is very contextual and topical. In India, and this is always talked about, that our public spending in health is very low. In fact, just to give some numbers, in India, public spending in the health sector has been historically low, which the government spending about 1.3% of the GDP for public health care, as opposed to the global average of about 6%. So we have a lot of ground to cover. With the union budget around the corner, what would you recommend to the government on this front, Himanshu?
Thanks, Gaurav. That's been a pertinent question, not just today, but for many years when it talks about the Indian healthcare system. The National Health Policy 2017 had put a target of 2.5% GDP spend towards healthcare by 2025. While we have moved in that direction, and now the spend is close to 2% of the GDP, but we are still far away from the desired 2.5%. And as you rightly said, that's lower than the global average, which is around about 6%, which is a mix of both developed nations as well as other developing countries. Now, the biggest challenge in India to achieve that level of GDP allocation always remains that India is a growing economy. So every year, while you maintain percentage-wise the GDP spend, you are increasing the actual spend on the healthcare, but as a percentage, it's not increasing that much. It's a large country, and government also has its own kind of challenges when it comes to allocation of funding. So what becomes critical is that government, besides looking at public spending, also tries and enables private sector investments coming into this space. And that's something that I think if this budget enables, that would be a big win in a good direction that the government would provide to the healthcare industry in the country.
You know, Himanshu, you know this more than many others, is that India's healthcare system faces persistent challenges, including a shortage of skilled workforce and infrastructure. which kind of disproportionately affects vulnerable populations such as low income and marginalized communities. These groups often rely on overburdened public facilities, unaffordable private care, or unskilled providers, resulting in poor health outcomes and very high out of pocket expenses. How can you create a sustained long term solution to this, Himanshu?
So, Gaurav, if you look at the last 5 years of the Modi government, in fact, a roadmap has been kind of set in this direction, which kind of tries to address each and every challenge that you mentioned, whether it's in terms of availability of health infrastructure or skilled workforce, and ultimately focused on bringing the out-of-pocket expenditure down for the vulnerable population in our tier two, tier three towns and rural areas. And this entire kind of roadmap, if you were to kind of club it all together, falls under the Ayushman Bharat group of schemes. So it all started with the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which provides the insurance cover to the bottom of the pyramid population. And now there are discussions that how the coverage can be expanded to the elderly as well as the missing middle in the coming years, to the infrastructure created at the last mile in the form of health and wellness centers, which have now been renamed as Arogya Mandir, which kind of brings back the focus on primary healthcare and preventive healthcare. So the idea that the government started with was that if they focus on ensuring primary healthcare infrastructure is there to service the entry point requirements, it will reduce the load on the secondary and tertiary facilities. And for those who kind of need to be at treated at the secondary and tertiary hospital, there is the insurance cover to take care of them. And the government didn't just stop there; they kind of enhanced the scheme moving forward to include the infrastructure mission, the Ayushman Bharat Beam, which now looks at medical colleges, improving district health infrastructure, improving the lab infrastructure, as well as the Ayushman Bharat digital mission, which then focuses on ensuring that our health data and records are in one place and digital interventions are there to service the last mile. Again, reducing the dependency of people to move from the hard to reach areas to tertiary and secondary facilities in larger towns. So all that in terms of the blueprint and the policy space has been done over the last 5 to 7 years. But what now needs to be done in this current and the third term of the government is that to see that it all gets implemented on the ground. While government over the last decade has made investments in this space from their own spending, what has lagged behind is the private sector investment coming into the space, and that's the key gap that still remains. And government needs to kind of focus on ensuring that how more private investment can go into this area, especially in the tier two, tier three towns and rural parts of the country. Because if you look at the private investment in the healthcare space through whether it's the mainstream financial institutions, banks, as well as the private equity players, a lot of money has come into the country, but all of it has been majorly focused or majorly concentrated towards tier one, tier two, tier one towns and metros into the large medical chains, large pharma chains, etc. Now the time is, I would say, apt that besides looking at those metros, government enables this investment to go in the smaller towns and rural areas, which will then help it in its overall blueprint of improving the health infrastructure for the last mile.
Himanshu, how can philanthropic investment be used to improve healthcare and solve other socioeconomic challenges, Himanshu?
That's a very pertinent question, Gaurav, that can government use and how government can basically ensure the private capital that I talked about goes towards tier two, tier three towns and rural areas. And that's where I think philanthropic funding can play a very catalytical role. And it can play this role in 2 to 3 ways. One is to see, government is always constrained of taking riskier bets. There are new innovations that are coming out of the Indian startup ecosystem, which government, unfortunately, because of its risk-taking ability, is not able to take up from the very beginning. And that's where philanthropic capital can come in to enable those innovations, to at least pilot them in few geographies, in few areas, which can kind of show to the government that, okay, these things work on the ground, and then the government is ready to take them up and scale them up. So that's one part. Second part is that if we look at the private investment, why they are not going to tier two, tier three towns and rural areas where the market exists, where you have uh, paying capacity also to a certain level. Why they are not going? Because they see health as a very long gestation period investment, and also an area where there is a certain level of public sector control, which does not necessarily allow them to get the return profile that they would want. So here again, philanthropic capital can come in as a kind of softener or a de-risker for the private investment through instruments like blended finance that the SAMRIDH facility focuses on. So what happens here is that when an investor is looking to invest in any technology or any solution provider in these hard to reach areas where they see the risk profile to be very high, the philanthropic capital can come in and de-risk that investment by providing that kind of cushion to the investor that, okay, if the investment fails, we are ready to bear part of the downfall, as well as kind of support the entrepreneur to move forward. So that's the second way in which philanthropic capital can play a big role. And third area is, which again the government has again created the blueprint and the policy space, is in the form of the social stock exchange that has been created. Unfortunately, right now, CSR capital does not qualify for investment through social stock exchange. But as we understand, government is thinking in the direction, and very soon expected to uh, allow CSR money flowing through social stock exchange in healthcare, in education, in scaling and other sectors, which will kind of allow more and more philanthropic capital getting invested in this space. So these are two, three ways in which philanthropic capital can play key role as a catalytic support, as a de-risker, as well as through mechanisms like the social support.
Himanshu, what is blended financing and how does it help in the last mile reach of affordable and quality healthcare? Himanshu.
So blended finance, Gaurav, basically is a concept where you try to provide affordable capital to any service provider or any innovator, which he or she is otherwise unable to get access to. So just to take a step back and give you kind of a few examples of how it works and what it is. So take an example of a first generation entrepreneur coming up out of an IIT who has designed a good medtech device which is affordable, made in India, addresses a key gap area. But when it comes for him or her to start manufacturing that device, they start facing a lot of challenges. Because what happens is that till the incubation stage, Government of India has, through the Startup India Mission, through Department of Science and Technology and other mechanisms, Atal Innovation Mission, etc., provided them the seed capital in form of grants. So incubation they are able to do, they are able to develop the products and services. But once they come out of that incubator and want to set up, say, their manufacturing plant, or want to, or have orders and want to service them, they don't have access to capital. And as I mentioned earlier, VC funds don't find this space very attractive because of the return profile and the gestation period. So the only option available for these entrepreneurs is to turn towards banks. Now, banks also, while supporting the healthcare space is a priority sector lending focus in the country, shy away from funding these entrepreneurs because they don't find comfort that these entrepreneurs have the capability to implement what they are saying, because basically they don't have the strong balance sheet, as well as because they are first generation entrepreneurs, most of the times they're not able to provide any kind of collateral to take those loans. So that's where blended finance comes in. And how it works basically is that if an entrepreneur goes to a bank to take a loan, and bank asks that, okay, I need a collateral to provide you that loan. So the philanthropic capital within this blended capital space comes in as a de-risker by providing a risk guarantee on behalf of the entrepreneur to the bank. So the philanthropic capital through blended finance says that, okay, if the entrepreneur fails to pay you back, I am giving you a risk guarantee that I will pay the bank either fully or part of the loan that the entrepreneur has taken. So basically, philanthropic capital is de-risking the investment in that way. Second way is also that, okay, the bank says, okay, I'm ready to give the loan, but the interest rate I'm going to charge is going to be upwards of, say, 15% or 18%, which the entrepreneur's business model currently is not able to service. So there also the philanthropic capital can come in and say that, okay, if the entrepreneurs achieves A, B, C milestones, we will take care of part of the interest burden. So that's how where the blending again happens, where you have philanthropic capital reducing the interest cost for the entrepreneur so that they can uh, develop their products and take them to tier 2, tier 3 towns and rural areas and to the vulnerable population. So these are some of the ways how blended finance works. So basically, in a nutshell, it's about ability of using the philanthropic capital to de-risk investments on the ground by merging the two forms of money together is what blended finance is.
Himanshu, what is SAMRIDH's approach towards building sustainable health systems?
So SAMRIDH, as you mentioned in the intro, was started just before the COVID pandemic, and the idea was that, and with the government, the discussions were that once the lockdowns start, the health sector within the country will be under a lot of pressure. Both the existing healthcare facilities will lose their usual business, and at the same time will be required to service the COVID patients. And on the other hand, at that time, if you remember, didn't even have the capacity to manufacture PPE kits, oxygen concentrators, and other things that were seen as critical to government to country's response towards the pandemic. So that's where the entry point for Samrid was, and it was precisely designed to provide these two parts of the healthcare delivery ecosystem, scale up their operations in the time of emergency, and address the challenge. Now, as the pandemic has gone down and as the facility has matured, now we are looking at the entire spectrum of the healthcare delivery ecosystem, from medtech device manufacturers to primary healthcare chains to supply chain solutions, as well as diagnostic solutions to tertiary and secondary level facilities, and helping them all get access to affordable capital so that they can increase their scale and capacities to provide access to affordable care to tier 2, tier 3 towns and rural areas, as well as if you talk about tier 1 towns, the low income settlements within those cities. So that's the approach that we are taking now, that how we can kind of address these different pieces within the health ecosystem, expand and provide affordable care through blended finance. And how, what we have done over the last 2.5 and 3 years is that we have raised substantial amount of philanthropic capital from USAID, from Rockefeller Foundation, Ford Foundation, etc. And at the same time got agreements with the mainstream banks like Axis Bank, HDFC, Caspian Debt, IndusInd, and continuously kind of merging these two capitals together to provide capital to these healthcare enterprises so that they can grow.
And Himanshu, what are some of the market-based solutions that can help access to quality and affordable healthcare, Himanshu?
So Gaurav, as I mentioned, we have taken a more of an ecosystem approach to this. So we are looking at solutions in every space. So just to give you a few examples from each space. So when you talk about medtech devices, we have over the last 3 years supported low-cost ventilators, for example. So now when we were importing, or when we still import ventilators from Europe and US, one ends up buying one for anywhere from 16 lakhs to 20 lakhs. whereas a homemade, made in India incubator of equivalent quality cost 6 lakhs or so. So that, in a way, kind of, if you make such a device available to the hospitals and in tier 2, tier 3 towns, it helps in bringing down the cost of delivery of those services. Similarly, other devices like pocket ECG machines, which cost as low as $100 and are of equivalent quality. We have supported a lot of other cardiac monitoring devices as well, which are much lower than the cost of imported goods. When it comes to things around supply chain management, we have been supporting solutions like drone-based delivery in hard-to-reach areas. For example, in states like Arunachal Pradesh, we have supported a company to provide last-mile delivery of pharma products within the public health system, which not only just reduces the cost of delivery, but also saves on time as well as reduces the carbon footprint. So that also kind of brings down the overall cost of delivery. Third, we have supported a lot of primary healthcare chains, which are in the private sector providing quality healthcare services at very minimal cost to the poor and the vulnerable, using both areas like telemedicine as well as point of care diagnostic. So that's the kind of helps in bringing down the cost. When it comes to higher level facilities, secondary and tertiary hospitals, there also we are helping them strengthen their infrastructure by setting up things like, say, tele-ICUs. Now, having a full-fledged ICU in a secondary level facility is not a feasible option. But if you have models of tele-ICU where your doctors can operate at a minimal capacity within the secondary hospital, that helps in bringing down the cost as well as increasing accessibility and affordability. So these are some of the ways in which we are trying to kind of do some way through supporting these enterprises, trying to increase accessibility as well as reduce the cost of delivery of healthcare. We have close to now 90 plus solutions and enterprises that we have supported in the last 3 years. We To support these enterprises, we have used close to $24 million in grant money, but leveraged almost 12 times of that money in commercial capital for them. So we have kind of helped them raise $270 million in commercial capital from banks, from private equity players to grow their operations. And now, as we speak, these 90 enterprises service almost all across the country. One product or the another is available. As well as many of these enterprises are now exporting. Last count that we did, their products have reached to over 17 countries globally, including European and the American market, as well as in the African and the Southeast Asian market. So that is the way the Indian healthcare ecosystem is improving, but these innovations are also able to provide affordable care and services to other countries as well.
Himanshu, to what extent do you determine your funding decisions through ESG, environmental, social, and governance principles, and incentivize businesses to be socially responsible, Himanshu?
So we have a very transparent system for selection of enterprises that we support. It's an open call that anybody can apply to and get access to support. B, we also reach out to specialized incubators, both public and private, that have been set up in the country to source innovation. And what we have done is we have set up a very strong governance body, an advisory board, which takes the final decision in terms of what gets supported and what doesn't. And this advisory board consists of people from the government, bureaucracy, people from the Principal Scientific Advisor's Office, from premier institutes like IIT Delhi, from financial institutions, etc. Now, in terms of when we are evaluating these solutions, the ESG is one of the key considerations that is given. from the environmental point of view, especially now that we are seeing much more and more impact of environment on the health as well as health's impact on the environment. So environmental concerns are very key. Social and governance concerns in terms of what kind of impact they're having on the ground and what kind of governance systems they have within the organization, what kind of policies and structures they have. We ensure that they do. As IPE Global, we are signatories to UN Global Compact. So anything that we work on has to have all those compliances in place, and that we ensure that enterprises that we are working with, either they already have those compliances and policies in place, or if they don't, then we work with them to kind of help them implement those policies within their organization. The other big aspect that we look at, and we recently also launched a toolkit around that, is the gender lens investing. Because what we found that when we started this entire program and this initiative was that women entrepreneurs was something that was lacking in our portfolio, and it's still lacking. So to enable that, what we did was we said that, okay, that can't be the case while there are a lot of women kind of in the incubation stage. Why is that they're not moving forward and getting access beyond that? So that's where we brought this toolkit in, and that's part of our kind of investment decision process, that we look at it, whether the entrepreneur who has started this initiative or this enterprise, what is the involvement of women in the decision-making process as founders or as key people in the management? What's the involvement in their own workforce? What kind of policies they have in their organization with the gender focus, as well as when they're servicing the endline beneficiaries, what's the kind of focus they have towards the gender aspects. So that again is another aspect that we keenly focus on. And to enable more women in this space, we have also tied up with several specific initiatives. So there's Women Entrepreneur Telangana, we hub that we have tied up with Women Entrepreneurship Program within the Niti Aayog is a key partner. So those two kind of engagements also help us in enabling that our investments follow the gender lens investing guidelines that we have set for ourselves. So in a nutshell, both ESG as well as GLI is a key focus in all investment decisions that we make.
Himanshu, finally, looking ahead, what do you see as the most promising innovations or mechanisms in healthcare financing and delivery that could significantly impact global health equity in the next decade, Himanshu?
Thanks, Gaurav. I think I will like to address there are two or three avenues where we see a lot of scope as we move forward to ensure that the innovations that are there are getting scaled up and helping in address the global health challenge. So one is from the technology side. So we are seeing of late and post-pandemic, and to some extent the credit goes to the pandemic for that, is that we are seeing a lot of emphasis on diagnostic capability and building new technologies which can diagnose illnesses as well as challenges that you face in healthcare delivery at a faster pace in an affordable way. So whether it be things like quick diagnostics for vector-borne diseases like dengue, malaria, etc., to much more advanced diagnostics around antimicrobial resistance, and seeing that what kind of antibiotics need to be given to the patient. So today, if you see from the AMR perspective, you get to know the antibiotic to be given after 3 to 5 days if you go for a culture. Now technologies are coming which can tell you the same or give you the same result within 3 to 5 hours. And some of them are within our portfolio as well, which we are supporting. So these technologies on the diagnostics side will go a long way when it comes to our preparedness for future pandemics and our response to future pandemics as and when they strike us. So that's one side on the technology. The second side that we are seeing a lot happening is on the supply chain side and strengthening of supply chain, specifically from the point of view of reducing the carbon footprint. So currently, the supply chains that exist have a huge carbon footprint. Now, a lot of technologies are coming which focus on reducing the carbon footprint of the pharma and the diagnostic supply chains that are very, very promising and can go a long way, in building our health ecosystems as well as reducing the carbon footprint of the health ecosystem. So that's the second part. And the third part, I think, which is happening on the financing side, specifically when it comes to a country like India, is the focus of the government towards result-based financing and towards blended finance. So 3 years back, when we started this initiative, we came up with a white paper on blended finance with NITI Aayog. And the same year, the finance minister in the budget speech also spoke about blended finance. And it has not just stopped at the talk, but it has moved forward through various initiatives. So Government of India is planning to launch a fund of funds in the near future, which will focus on impact-driven businesses. It already has investments through the likes of NIF, SIDBI, etc. But this term is expected to see many-fold increase in the allocations towards that. That's one part. Second part is Government of India has on their own started credit guarantee programs through the likes of National Credit Guarantee Trustee Company. And we again foresee that this term will see increasing allocations towards that. And third, which is an emerging area, is the entire concept of social stock exchange, which again got pushed in the budget a couple of years back, but came to light last year with NSE and BSE both having their first listings. And now, as I understand it, NSE, close to 10 enterprises have already raised funding using social stock exchange as a platform. And we see that going forward, as government allows CSR money to go into social stock exchange, that becoming a much more active space for enabling the innovative financing and enabling the ecosystem to grow. So government has taken a lot of steps to move away from the traditional public-private partnership model towards these innovative financing models, which are much more conducive for the ecosystem development and much more liked by the private sector as well. And we see that the next 3-4 years to be very, very exciting and kind of taking this forward. We recently also, in partnership with the National Health Systems Resource Center, which is part of Ministry of Health and Family Welfare, came up with another white paper on use of blended finance on the intersection of climate and health. This again was launched a few weeks back, and that white paper again kind of helps in taking this entire agenda around blended finance and what we have been trying to do through SAMRIDH over the last few years forward and scale it up. So that's where we see it going, and we hope that we'll continue getting both government as well as philanthropic support to take this tri-sector partnership forward.
Thank you, Himanshu. Thank you for sharing your deep insights and perspective and taking the time out to drop by and have this conversation with us. Thank you, Himanshu.
Thanks a lot, Gaurav, for giving us this opportunity to share our work and we hope that this discussion and many others who listen to this pod will take forward the concept of blended finance in healthcare and in other sectors forward. Thanks a lot.
Thanks so much.